morning, everybody. Good morning, Lou.
Good morning.
So today we're going to be talking about obsessive compulsive disorder, commonly known in vernacular as OCD. And OCD is something that I saw a lot of in my earlier years as a psychiatrist. And more recently, I would say in the last 20 years or so, we have very good treatment for it. So it doesn't present as it did back then. When I say back then, I mean about 50 years ago. And from here, if you notice, the name of the show is Memoirs of a Psychiatrist. I've been talking about my memories. I've been talking about my experiences. So far, we've talked about opiates. We've talked about anxiety disorders. We've talked about hypnosis, solving of murders, and so on. And today, we're going to be talking about OCD. And then what I'd like to do is to take a little bit of a diversion here, because after all, my memories have to do with not just my clinical experience, but also other experience in life and with patients. And the next session is going to be talking about something that was a life-changing experience for me. Thanks to my wife, she invited me to come to a lecture. I went, and that really changed my life, and I'm hoping that it will be change of life for those of you who might follow with me along that journey. I know that when I brought it back to my office and started talking about some of the things I learned with my patients, people who had been there with me for a long time, many years, asked me for paper and pencil and started taking notes, and they found it very, very helpful. And I know from personal experience, I found it very helpful. But today we're going to be talking about OCD, obsessive compulsive disorder, and going back, let's say, to the 1970s, when people came in, they were already at a very, very advanced stage of OCD, which we don't see as much today because there's so much treatment available. Obsessive compulsive disorder refers to two things. One is obsessions, and one is compulsions. That's why obsessive compulsive disorder. The obsessions refer to thought process, repetitive thoughts about something or the other that they cannot get rid of from their mind. Compulsions refers to actions, things that they do that they cannot stop. Obsessions and compulsions. Now you can have purely obsessive OCD, where people only think certain things that they can't get rid of, or purely compulsive, where they do things without the necessary component of the obsessions. And then there's mixed, where they have a little bit of both. Obsessions typically have to do with dirt, cleanliness, have to do with possibly having caused some harm to somebody. I had one patient who kept thinking as they were driving that they heard a thud, and they would think, oh my God, I hit somebody. And they would stop the car, look around, say, I'm pretty sure I hit somebody and ran over somebody, and then they'd go around the block looking to see if they'd hit somebody, if cars were stopped. Another typical one is checking to see obsessions about whether or not they've turned off the gas or locked the front door.
Right.
And people have this obsession, and then along with it comes a compulsion to make sure that they've checked the gas by turning the knobs repeatedly or going back to the front door and checking the front door repeatedly. Cleanliness is a big one. People have this hand washing compulsion or foot compulsion, where they take off shoes for fear of dragging dirt through the house, or washing their hands for fear that there's going to be some kind of contamination that they're bringing in from the outside of the house into the house. And obviously, no homes are sterile environments like an operating theater.
Right.
Even an OR is not 100% sterile, but certainly homes are definitely not, with kids coming in with all kinds of stuff. No matter what you do, you cannot make it a sterile environment. But people who have OCD tend to take it a little too far.
So OCD owners aren't big pet owners. They're not owning dogs.
Not owning dogs, yeah. Well, there's two things that I want to address here. One is the aspect of compulsions. Now, you know that most religions will offer some kind of a compulsive, repetitive action or a ritual in order to get people to feel calmer. So in the Christian religion, it may be say the rosary so many times,
Right.
say Hail Mary so many times. You know, it's a repetitive thing. In other religions, it's other kinds of ritualistic behavior that the priest suggests as a way of binding one's thoughts, guilt, actions, etc. So OCD essentially uses compulsions as a form of binding its own anxiety. Problem is that it's run away with itself. And last time, I don't want to repeat all of last session where we talked about serotonin, whether it was last session or not, I don't remember. But there was a session where we talked about serotonin. And OCD is very closely tied to a diminution in the serotonin levels in a person. The uptake mechanism of serotonin is excessive, and so it sucks up a lot of the serotonin, and there's less serotonin available, free available serotonin, which makes that person more obsessive or more compulsive. So the compulsions are a necessary part of binding anxiety, and that's why the OCD. The second thing I wanted to say is that OCD in and of itself is not necessarily pathological. Lou and I were having a discussion earlier where we were saying how people are often meticulous about something, and there's nothing wrong with that. I mean, if I had to go to a plastic surgeon or a surgeon, I would want that person to be meticulous in terms of tying up every loose end, every artery or vein that they nicked or cut, so that there's no bleeders inside me after the surgery.
Right.
If I went to an accountant, I'd want the accountant to be meticulous in terms of his numbers and how he puts things together. I wouldn't want a sloppy anything, whether it be a sloppy barber, a sloppy accountant, a sloppy surgery. Everybody has to take pride in their work and keep their work space and their home space neat, clean, and organized. So that extreme, one extreme, is normal meticulousness and perfectionism, which does not cause any anxiety, grief, or stress to oneself or to those around them. And the other,
that's a good differentiator, huh?
yeah, how much stress it causes to other people. Because a lot of times, in the olden days, 50 years ago, there used to be differentiation between obsessive compulsive neurosis
Yep.
and obsessive compulsive disorder. And the neurosis basically versus a personality disorder. Personality disorder never caused any discomfort to himself or herself. Everybody around him says, I can't take this anymore. My wife is crazy about ashtrays, because 50 years ago everybody used to smoke. Every home had multiple ashtrays. People smoked and
Right.
put ashes in their ashtray. And typical OCD symptom was when a husband would come with his wife and say, she drives me crazy with the ash. There's ash on the table, there's one speck, and she freaks out. But it didn't bother the wife. She says, I'm just trying to keep a clean house. But it was so extreme that everybody in the house found it very disturbing.
Yes.
So, personality disorders, the patient himself or herself has no issues with it, says, I don't know why I'm here in a psychiatrist's office. My husband told me to come, so I'm coming. I don't
Yep.
think I'm doing anything wrong. As opposed to an obsessive compulsive neurosis. Now, this is an old definition, but it sort of explains things fairly well. A neurosis, a hallmark of neurosis is anxiety. And a person who's obsessive compulsive neurotic gets anxious about his or her obsessions or compulsions. And that anxiety is what a psychiatrist might use to motivate the person to get better. Because otherwise, if there's no motivation, there's no
Right.
way to get this person better. At that time, we didn't have medications. Now, whether the person wants to or not, a little bit of an SSRI and the person's much, much better. Going back to 50 years ago, the treatment of OCD was bizarre, to say the least. There was something known as flooding. We'd send them to a particular clinic, which was world-renowned, and they'd basically say, if you have a phobia of dirt, then they're going to flood you with dirt, and it was really painful.
Immersion.
Yeah, immersion.
Yeah.
And it was, bizarre. And patients often came away from there worse than when they went in
Imagine.
there.
Yeah.
Other forms of treatment were psychotherapy, psychodynamic therapy, psychoanalysis to say where did this come from, what happened in your childhood, until the SSRIs came about. And I think we talked about this a little bit before, where the brand names of SSRIs, which lay people will understand, are Prozac, Paxil, Luvox, Zoloft, and so on. Prior to this, there was something known as imipramine or tofranil, and those are tricyclic antidepressants. So these came way before the SSRIs, and tricyclics like tofranil and Elavil were very, very helpful in a lot of different psychiatric disorders. Along came a tricyclic known as clomipramine. Clomipramine was very, very useful for OCD, and at that time was not available in the United States. It was only available outside the United States for various reasons that the pharmaceutical companies wanted to shut it out.
Right.
But people actually drove to Montreal and picked it up there and brought it back to the United States. And subsequently, actually, this Canadian pharmacy started mailing them to patients if they included a prescription from a U.S. pharmacy. The change in these people was miraculous with the proper medication. And then with the advent of SSRIs, Luvox in particular, Lexapro, there's so many of them, in the right dosage. Underdosing these conditions did not result in treatment. Immediate and miraculous treatment, to the point where we don't actually see these patients today getting to the end point that we did 50 years ago, because patients bring themselves to a doctor, or their families say to them that you need to go get some help. So that's about obsessive compulsive disorder. Now, the layperson knows of obsessive compulsive disorder as a hand-washing compulsion or cleanliness fetish, but there was an article which I wish I had the foresight to print out and bring with me, which was known as an obsessive compulsive spectrum disorder. Fascinating concept that talked about an obsessive compulsive disorder being on a spectrum, that from risk averse to risk taking behavior.
Oh, interesting.
Very, very interesting how they put in there that a lot of conditions that we see that we never would consider as part of OCD are really OCD components and can be treated the same way as OCD. For instance, anorexia nervosa. Most of us know what anorexia is. It's where mostly females, younger females, look at their body and think they're fat, even though they're not.
Right.
Everybody tells them you're not fat, you're only 105 pounds, and they say, are you kidding me? Look at me in the mirror, I'm so fat. And they will stop eating, and they will obsess about food, about how much and they will measure every little bean, one bean, they'll measure it in terms of weight and calories, and they'll measure the food, and they'll count the calories, and they will step on the scale many times a day. They'll go to the gym, and they'll measure calories. So this person who wrote the article, and I apologize that I don't remember the name of who wrote this article or what that article is, but he said, isn't that very similar to obsessive compulsive disorder? Because what does this person do? All she's doing is obsessing about weight, calories,
right,
body image, and compulsively taking necessary steps to control her weight. So
Makes
she's
perfect
got
sense.
OCD.
Yeah.
But it's not risk-taking. She's not doing anything to hurt herself. So it's on this end of the spectrum, which is risk-averse. So if you treated, and at that time we had really very little treatment for anorexia or bulimia, and then we started treating people, I don't want to make this too simplistic, by OCD treatments, and a few of them got better. I can't say that the majority of them got better. I cannot say that all of them got better, but a few of them got better. Then we learned from various articles and letters that physicians wrote about other things that they used, including naloxone and other medications that we gave, and then we had even greater success and adding other stuff to it. On the other end of the spectrum, obsessive compulsive disorder, were risk-taking people. So, for instance, I had a patient who was married, very attractive young wife and 2 kids, a wealthy guy, and his wife brought him to me because she says he has a compulsion where he goes into New York City. At that time, there was this thing called 42nd Street, where there were streetwalkers, prostitutes on the street that he would just go pick up and have sexual contact with in his car on the street and then drive back home without protection. And she said, I don't want anything to do with this guy. You know, at that time there was this fear of AIDS, and AIDS was around, and she said, I don't know what he's doing. And I talked to him, and he says, Doc, I don't know why I do this. He says, I have this thought, I can't get it out of my head. I find it very stimulating, very appealing. I drive into New York City, my heart's pounding. I hate myself for doing it. I don't want to do it. I love my kids. I love my wife. But I cannot stop. And then he does it, and then he gets panicky, and he goes to doctors and says, treat me for potential AIDS and stuff like that. And so that's risk-taking, where it's like an obsessive compulsive disorder. The repetitive thoughts of going into New York City and compulsively doing something like this is an obsessive compulsive disorder, and I treated him like that. Let's not go into what exactly happened with that particular individual, but that's a form of OCD. Hoarding was another common one that I used to see a lot. I haven't heard of it so much now, plus I'm retired now, so I don't know. But there were a lot of people who just obsessively hoarded either all stuff or particular kinds of stuff. I had one gentleman who hoarded paper tissues and napkins and paper towels. That was the only thing. But his family said they all left him because the house stunk. It was smelling, and the city then condemned his house.
Used napkins and paper towels.
Used napkins, even other people's, not just his.
Wow.
If you go to the bathroom, you know how sometimes in men's room, there's like paper towels lying on the floor, and because the wastebasket is full, he'd pick up those paper towels, bring them home, and save those. And the whole place would be full of paper towels, napkins, tissues that he never touched. And he never understood why he himself did it. He didn't understand. He says, but he would kill if somebody tried to get rid of those. So hoarding is another form of obsessive compulsive disorder. So let me see. I just made some notes here. Excessive cleaning and or hand washing, ordering and arranging things in a particular precise way, repeatedly checking on things, such as repeatedly checking to see if the door is locked or that the oven is off. Compulsive counting is another thing. Compulsively counting over and over again. Compulsively lining up one's shoes or other people's shoes in your home or clothes, etc. And the obsessions are repetitive thoughts, fear of germs or contamination we talked about, unwanted, forbidden, or taboo thoughts involving sex, religion, and harm. So that's another very common one that have to do with looking at the statues of Jesus or Mary and having an unwanted sexual thought cross the person's mind and say, oh my God, it's killing me. I'm a very religious person. Why do these thoughts about these dirty thoughts come into my head? Aggressive thoughts towards others or towards oneself. And having things in a symmetrical or perfect order. So we talked about addictions, and alcoholism. Did we mention that just now?
No, we haven't mentioned alcoholism.
So alcoholism was another one.
I find it fascinating that all these disorders weren't grouped in as OCD, and they make, once you think about it in that regard, it makes perfect sense, doesn't it?
So an alcoholic would have the same obsessive compulsive features, except that with alcoholism, a second component kicks in, which is that it becomes an actual chemical desire. So then, first it starts off as an obsession after the first few times where the person says, wow, this buzz is great. I want to drink this alcohol. I can't wait to have something to drink. That obsession of wanting to drink with the repetitive drinking is again an obsessive compulsive disorder, but it results in a chemical need for that alcohol.
An addiction.
An addiction. And it results, therefore, in a genetic transformation that then gets passed down with enough alcohol in the system for a long enough period of time. As we know, alcoholism does run in families. So that's alcohol. Then two other things that I want to mention. One is trichotillomania.
Oh, I was waiting for this.
You've heard of it?
No, I haven't. That's why I was waiting for this.
Trichotillomania is picking hair from one's body.
Oh.
So there are women and men who pick hair from a particular part of their head in a compulsive fashion, and they continue to pick it until they develop a bald patch.
Interesting.
And they can't stop, and they find it ugly, and so they'll take another part of their hair and they cover their bald patch, but they say, I can't stop this. I need to stop this. It's a compulsion. And again, treatment is just as the same as with other OCDs, with SSRIs and other chemicals, medications. Interestingly, I found that a lot of dogs also have trichotillomania.
Really?
Yeah. And it's fascinating. A woman actually came to me and said, Doc, my dog has trichotillomania. And she also had it. So she says her dog has it. Now, of course, as a physician, I thought to myself, how is this?
Yeah.
I mean, she has trichotillomania, her dog has trichotillomania. So what the dog would do is reach down with his teeth and then sort of gnaw at his skin, at his fur, and make a bald patch for himself, just as she did. Whether he did it because his master
isn't it? Yeah.
Fascinating.
Yeah.
But she got better with the use of an SSRI, and she says, can I give this to my dog? And I said, I don't know. I'm not a veterinarian. You can talk to your veterinarian, but, I don't think it could hurt him. She did. Whether she talked to the veterinarian or not, I don't know, but she gave the dog. Prozac at that time came in liquid form. It also came in capsule form, so she would open it and put it in water and give it to him. And the dog got better. So trichotillomania is another one, OCD spectrum disorder. And the last one that comes to mind is body dysmorphic disorder. So body dysmorphic disorder, also known as BDD, is a condition where the person looks at himself or herself in the mirror and sees a flaw in his or her body that nobody else sees.
Yes.
Or
anorexia, right?
Anorexia is one.
Yeah.
That's body dysmorphic disorder. But generally, it is more that the person looks at his or her nose, for instance, or lips, or eyes, or breasts, or abdomen, and says, my nose is crooked. My nose is too bulbous. My nose is too this. My lips are this. And they will compulsively go for plastic surgery.
Right.
And plastic surgeons dread these kind of patients because they come in and they say, there's no way for them to know. So now plastic surgeons have often cosmetic plastic surgeons, started referring these people for psychiatric clearance before they will do anything.
Because it's possible that person's never going to be satisfied.
They never are satisfied because they're body dysmorphic disordered patients. After the surgeon does their surgery and it looks beautiful, the husband will say, wow, look, I love your nose. Person says, no, it's actually worse than it was before. I'm going to sue that plastic surgeon. Go back to the plastic surgeon. Well, what do you not like? I don't like ABC. Okay, I'll do it over again. And they do it over again, say, you made it even worse.
Right.
So it just goes on. And that's what happens with a compulsion. It's just on and on. The obsession that it's not right, followed by a compulsive ritual. So that's OCD.
I want to go back, circle around to the one point you made that I think is interesting, is that when a disorder is defined as, or can be defined as, the amount of stress it causes you and people around you.
Right.
That's the difference, because we were joking before the show. I was talking about how I don't like to leave dishes in the sink. So if I'm not stressing myself out and I'm not stressing other people out with it, it's just meticulous, or it's just a...
Yeah, not necessarily that, it's OCD. If you fold your clothes, people who come out from, before they go into the army, for instance, right? There might be a sloppy young teenager or young man of age of 20, goes into the Marines. He's taught to say, you know what, you got to fold up your clothes and put them neatly. Everything has a place, and everything has to be in its place. Everything in its place.
Right.
What's that saying from the Marines? A place for everything and everything in its place.
Right. Yeah.
So by the time they finish their tour of duty, they're actually finding that keeping everything in its place, neat, clean, gives them a semblance of peace and comfort.
It's ritual, which is very important
It's a
to us.
ritual.
Yeah.
It is very, just like I said, you know,
Yeah.
religions give rituals as a prescription to bind their anxiety. So
People love rituals.
people like it, people like orderliness,
Yep.
and there's nothing wrong with that. So if you come away from the Marines after being a sloppy kid, and then now you're a meticulous, orderly, disciplined young man, and you say, when I have that discipline, I feel good about myself, that's not a disorder.
It's the opposite of what we talked about. It's not causing stress to you or anyone. It's giving you peace.
Giving you peace,
Yeah.
correct. So that's it for OCD, and I think what I'd like to do is to invite all of you to please listen. Starting next time, I'm going to be talking about something that changed my life and that of millions of people around this world, going back thousands of years, and I hope that it will help you also. Please do listen. It's in a segment that I call Gita, G-I-T-A, Gita, which means Song of Life. So I'll be talking about that next time, and I
You
hope
can
to see
find
you
our sessions on Facebook and on YouTube under Memoirs of a Psychiatrist. Come and like us on Facebook. Come and subscribe on YouTube so you know when our new sessions are out. Fascinating, Doctor. I can't wait for the next one.
Thank you. And I'd like to invite comments from you. In addition to what Lou said with likes, if you could just comment, questions, ask me things, I'd be happy to reply to you. Please. Thank you for listening. Thank you for watching, and I'll see you again next time.